Is having a big heart a good thing or a bad thing? Stick around to find out because your favorite cardiology nurse practitioner is going to break it down for you. But first, hello everyone. My name is Ray and I'm a hospital-based nurse practitioner who specializes in cardiovascular disease. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we like to talk about heart disease, both prevention and treatment, other topics related to the heart, and overall health and wellness. So if that sounds good to you, let's get started. So, have you ever heard someone say you have a big heart? Well, metaphorically speaking, it's probably what they meant to say is that someone's kind or compassionate or considerate, etc. But if you're a doctor, you know, and you tell someone that, specifically if it's a cardiologist, and they tell you that you have a big heart, that's probably a different story. So I want to tell you about a patient that I had recently that came in with left arm pain and a hot sensation in her chest. Additionally, she noticed that her blood pressure was very elevated. Of course, we wanted to make sure that she was not having a heart attack, as you've probably heard that sometimes people having a heart attack, they can have chest pain that radiates down to the left arm. So we got an ECG and cardiac biomarkers. Her ECG was not consistent with a heart attack. Um, it wasn't normal, but it wasn't consistent with a heart attack. Her biomarkers, her troponins were negative. So we did complete a coronary CAT scan or CCTA, which did not reveal any coronary artery disease. We also obtained an echocardiogram, which did have some abnormalities. Her echocardiogram showed findings concerning for something called hypertrophic cardiomyopathy or HCM. According to Dr. Eugene Braunwald, who he's considered to be the father of modern cardiology, HCM is a genetic heart disorder characterized by hypertrophy or enlargement of the left ventricle wall. And that enlargement is not explained by abnormal loading conditions or myocardial infiltration. It's estimated to affect about 1 in 500 adults worldwide across all sexes, races, and age groups. In HCM, the left ventricular cavity is typically small with increased contractility and abnormally elevated ejection fraction, or EF, which is the pumping function of the heart. By the way, the left ventricle is considered the workhorse of the heart. It's the one that pumps blood through the aortic valve and out to the body. A large group of HCM patients can develop obstructive HCM. So my patient, she actually had a normal ejection fraction, which is consistent with HCM, but she had moderate left ventricular outflow tract, left ventricular mid-cavity, and left ventricular apical cavity obstruction at rest. So this diagnosis is suspected based on the echocardiogram findings, and it's confirmed with a cardiac MRI. In our hospital system, we actually have an HCM specialist, and this is the gold standard of care to be referred to someone who specializes in these particular patients. Most patients have a pretty benign course. However, it remains an important cause of sudden cardiac death in adolescents and young adults. You've likely heard the stories of the young athletes dying suddenly. There was actually a very distinguished runner. He's a NCAA 10,000 meter champion, Ryan Shea, that died suddenly in 2007 while on a marathon. He was in the Olympic trial, marathon in New York City. It's believed that he had HCM and he didn't know it prior to this race. So HCM can cause lethal arrhythmias such as ventricular tachycardia, non-sustained ventricular tachycardia, and syncope or passing out. HCM can also cause atrial fibrillation, which is very poorly tolerated and may require anticoagulants for stroke prevention. So what's the treatment? Glad you asked. At this time, there's one medication that is FDA approved for symptomatic NYHA or New York Heart Association class 2 to 3 obstructive HCM to improve functional capacity and symptoms, and it's called mavacamten or Camzyos. By the way, the New York Heart Association scale, it's a scale that puts patients in one of 4 classes. Class 1 would be no physical limitations, no symptoms. Class 2 would be slight limitation with physical activity. They're comfortable at rest, but ordinary physical activity causes them symptoms of heart failure. Class 3 is even more limited physical activity, and less than ordinary activity causes symptoms of heart failure. And finally, Class 4 is the worst, with symptoms of heart failure both at rest and with even minimal activity. So besides Camzyos, other treatments include medications such as beta blockers, calcium channel blockers, and an antiarrhythmic called disopyramide. Sometimes patients require a surgery called a septomyectomy, which is an open heart surgery to remove a chunk of the thickened muscle. Sometimes patients may be a good candidate for an implanted defibrillator as well, which that'll be put in by an electrophysiologist. HCM is a growing specialty in cardiology that's rapidly evolving, and requires expert consultation. If you've been diagnosed with this, you'll likely have genetic testing, and your cardiologist may recommend that your family, such as siblings, get tested as well because there's some genetic predispositions. So I want to hear from you all. Have any of you ever heard of HCM before today? Let me know in the comments below. If you've made it this far, I want to thank you for spending your time with me today. Time is one of our most precious gifts we can give, and it's finite, so I thank you for sharing yours with me today. If you have any questions about this or any video, feel free to leave me a comment. I read and answer them all, and I look forward to an engaging community. If you found this video to be helpful or informative, please let YouTube know by subscribing to the channel, and make sure you turn on your notifications so you'll never miss when I upload a new video. Also, please consider sharing this with the people you love in your life. Together, I think we can decrease the burden of heart disease one video at a time. By the way, please go check out my other videos about diabetes, hormone replacement therapy, and heart disease, Ozempic or Wegovy, and how it relates to heart disease, or how to get started with fasting. So I hope to see you in the next video. God bless you.